Welcome once again to another episode of Ask the Doctor. I'm Dr. Wale Okediono, a family health physician for 45 years in practice. As before, we're going to listen to 8 questions sent in by my patients and I will answer them. The first question is this: I fart a lot at night. It's from a man. He said, my wife complains that I fart a lot while sleeping at night. Can you let me know how to stop this rather embarrassing habit? And my answer is that aside from being a source of embarrassment, passing gas, that is, passing flatulence, is common and usually harmless. It is estimated that most people pass gas between 13 and 21 times every day. Flatulence during the night is generally due to diet and lifestyle, although there are some digestive disorders that can cause excess gas. People commonly fart in their sleep, or they're usually not aware of it. Research shows that pressure, it shows that there is a muscle at the entrance of the anus, and this is what controls whether or not a gas that is in the large intestine will be released. This muscle will spontaneously relax several times in an hour in the morning, in the afternoon, or night. As a result, passing gas overnight or in the morning is common. If you want to fart less during the night, you should try and make sure that you don't eat too late to your sleeping time. By making lifestyle changes or addressing underlying health issues, you may be able to reduce your nighttime or morning flatulence. Actions that you can take are the following: avoid talking while eating and drinking so that you will not swallow too much air. Stop chewing gum and eating hand candy if you like it. Avoid drinking carbonated drinks like Fanta, Coke, and all those things. Stop smoking and eat small, frequent meals. If these ones do not help, then you can see your doctor so that you can check if there's other problem that is causing you to be passing gas too much. Then the next question is about the husband. The lady is asking about the husband. He said the husband sometimes vomits a lot, and when he vomits, there is some blood in the vomitors. Then, although he will feel better, but frequent vomiting with blood is making the woman to feel worried. So my answer is this: I said bleeding from the mouth can be a sign of various medical conditions, some of which can be serious or even life-threatening. It is possible that your husband may have burst a blood vessel in his throat or has an injury to the mouth. It is also possible that he may have some underlying illness, maybe in the stomach. It is very important for you to find out if your husband has been drinking a lot alcohol these days. Because if he's taking too much alcohol, it could cause some bleeding in the stomach, and this bleeding can come out as blood. And you need to also convince your husband to see the doctor so that I can explain better. It is important not to delay, because when you delay these kind of things, it may become worse and then gets more difficult to treat. Then the next question is from a young man. He said, what is diphtheria? I read in the newspapers about the alarming spread of diphtheria in my country. Can you let me know more about this disease? My answer is that diphtheria is a serious infection caused by strains of bacteria called Corynebacteria diphtheria that can make some toxins, that is, some harmful secretions in the body. It can lead to difficulty in breathing. It can have heart problems and can even lead to death. Vaccines are normally recommended for infants, children, teens, and adults to prevent diphtheria. The bacterium that causes this problem can be taken care of by vaccination, and the bacteria usually lives in warm climates, that is, in tropical climates, and it can develop. When you have this diphtheria, it can develop into skin sore that may not heal, and then it's also considered an endemic. Sometimes it can become very common in some countries in Eastern Europe, in South Pacific, Middle East, and co. And you can catch it through airborne droplets that contain the bacteria. That is, they can be spread by sneezing, coughing, or spitting, or by touching something that has that bacteria inside. It is also possible that an infected person could transmit the disease through an open sore. So, what is important is to always get children to be vaccinated so that they can start at the right age, and then that will protect them from multiple infection. Apart from diphtheria, it will also protect them from whooping cough, and it also protect them from tetanus. So all these ones can be controlled by vaccination. And then, if somebody has diphtheria, the treatment is not that bad. It's a simple treatment which the doctors can recommend. Then the next question, the fourth question is, what are the symptoms of blood cancer? He wants to know what one should watch out for to know whether one has blood cancer. And I said blood cancer is what we call leukemia. And some of the signs of this leukemia include weight loss. The person may be losing weight, and some people may also have itchy skin. Their body will be itching them, and this itchiness may even get to the extent that when they itch their skin, it can peel off, and they will start seeing some blood, causing some bleeding and sore on their body. And then some people also have shortness of breath. They are breathless. That is, they can't breathe well, and they usually need oxygen to take care of themselves. And luckily, when caught early, blood cancer, because of new developments, is something that is treatable. And the earlier it's caught. So when somebody has this kind of symptoms, you should see a doctor so that they can be diagnosed and treatment can start early so that it will not get complicated. Another question is this: I want to know whether what I'm having is kidney disease, whether it's kidney failure. I've been having a serious reaction in my urine, reduction in my urine output for a while, and then in addition I also have swollen feet. Can you let me know whether this is kidney failure? Then my answer is that although reduction in your quantity of urine output can be a sign of kidney failure, it's usually not the only important sign. Other presentations of kidney failure include swelling in the legs, ankle or feet, fatigue, shortness of breath, confusion, nausea, weakness, irregular heartbeat. Sometimes you can also have chest pain or pressure in the chest. So once this kind of symptoms come up, particularly swelling of the ankles and difficulty in breathing, then you need to see a doctor so that he will do a proper examination and give you the necessary laboratory tests. The next question is about bananas. The question goes like, you say I'm a diabetic, but I love eating bananas. I want to know if I can continue to eat bananas. And my answer is that bananas are very high in carbohydrates and sugar, which are the main nutrients that raise blood sugar levels. However, bananas also contain fiber, which may reduce blood sugar spikes. In general, most people with diabetes can eat 1 or 2 medium-sized bananas a day, keeping in mind that other fruits in addition to other fruits they may be consuming. It is important to know that the ripeness of the banana can also affect the sugar level. Therefore, green or unripe bananas contain less sugar and more resistant starch, whereas fully ripe bananas have very high sugar content. So therefore, people who are diabetic are usually advised to take more of unripe bananas instead of ripe ones. The next question is that's the seventh question. He said, my severe back pain. He said, I've been managing my back pains with some drugs for the past few weeks without much improvement. Can you let me know the best way to manage the problem? And then my answer is that the best solution for back pain depends on the underlying cause. and the circumstances that brought about the back pain. In many cases, conservative treatments are effective and should be considered first. And these conservative treatments include rest, application of ice or heat therapy over the back, using over-the-counter pain relievers, and some gentle stretching exercises. Physical therapy can also be beneficial because it will help strengthen the muscles supporting the spine and it improves flexibility. Maintaining good posture is also very good, whether you are at home or when you are working. And of course, it is also nice to sleep on hard, soft mattress, not mattresses that will be sagging in the middle and causing more pain for you. You can also put your mattress on some hard blackboards so that it will straighten your back. And then, for those who are very who are fat, it's nice to reduce your weight and take care of yourself by having regular exercises and avoiding activities that will strain the back at the back. The last question here is about Alzheimer's disease, and it says, I want to know how to help my father to slow down his Alzheimer's disease, which he has been living with for the past 5 years. So the father has had Alzheimer's disease for the last 5 years. He wants to know how it can slow down. And my answer is that research is ongoing to develop a drug with the ability to slow down the development of Alzheimer's disease. Also, some diets, particularly what they call the Mediterranean diet, have been suggested to reduce the progress of Alzheimer's disease. In this diet, you have to eat limited saturated fats and simple carbohydrates. And then it's also good to increase your consumption of fresh fruit, vegetables, and fish to prevent Alzheimer's to be getting out of hand. It's also been confirmed that people who you should stop living solitary lives with limited interaction with others. People who have regular social engagement usually get better when they have Alzheimer's. You should socialize more and make more friends, attend events. This way, it will reduce your Alzheimer's disease. And then some games, puzzle games, learning a new language, or playing an instrument can also help. Numerous studies have also shown that a positive relationship between exercise can also help. So I think you have to encourage your father to do some exercises, even if it's just ordinary walking. This brings me to the end of this set of questions. Once again, I'm Dr. Wale Okedino, a family health physician of 45 years practice, and I would like to thank you for listening. We'll see you at the next episode. Bye.